Hi, I'm Dr. Jennifer Taylor. I practice in Plano, Texas, which is just north of Dallas. And I am an upper cervical chiropractor. So, what that means is that I do very precise adjustments on the upper cervical spine. This is the top two bones, C1, C2, and they surround the brainstem. The brainstem controls all your breathing, controls all your heart function, but it also controls all of your posture muscles. So, in essence, not only do we look at this in a very precise manner, but we're able to address the entire spine with a very gentle and precise adjustment. I am vice president of my technique group, which is called the Society of Orthospinology. And I am a director for the International Chiropractic Association Upper Cervical Council. So that's kind of a lot there, but I work on those boards primarily for legislation and also to further people's knowledge about upper cervical chiropractic care and the technique that I do. I've also attended a 3-year course, which is a diplomate course, which is furthering the studies in the upper cervical area. I'm a diplomate of chiropractic in cranial cervical junction procedures. It's a DCCJP, extra letters after my name, just stating that I'm even more specialized in the area. We're trying to get more and more of us out there. It's so needed, this type of precision care in the chiropractic field. I was not brought up in a chiropractic family. I was brought up in a family that it was, you go to the doctor if you feel sick, and here's your drugs, here's, this and that. If there was any sort of emergency, my dad, he was always able to kind of stitch us up and things like that. So we didn't go to the doctor too often, but there was never any look outside of that. Not that it was, anything that he didn't necessarily believe in. He just didn't know about it or look into it. And my mom, she was always really interested in nutrition. She actually sold Shackley for a while, Shackley products, if you remember those. But I never really was taught one way or the other. So I really think I had an open mind when it came to health and healing. I started working for a chiropractor right out of high school, and I just wanted to be an office manager. I didn't really go looking for chiropractic. It just kind of found me, I think. And at that time, I was suffering from terrible migraines. At least 2-3 times a month, I'd be laid up for about 24 to 48 hours. And once I started chiropractic care, they just miraculously went away. I learned a lot about my spine. I learned how my neck was not in the proper position. Basically, you're supposed to have like a backward C-shaped curve in your neck. And mine was actually going backwards in the opposite direction. So my neck, all those muscles of my neck were super, super tight. They had all the nerves and everything in that area were really compromised and irritated and inflamed. And anytime I had stress, or whether it be, emotional or physical stress, that would actually tense everything up even more and perpetuate those migraine headaches. There's other things too that were going on, but in a sense that was going on. And once that curve correction was made, my life actually returned to normal. So that was something that I found for myself that actually saved me many, many years of drugs and more drugs. And then you have to get off another one and get on another one. I mean, I see people go through years and years and years of suffering with these things. And I was so glad that I found it at age 19 years old, rather than having to go, 10, 20. I have some people that walk in my office, 30 years, migraines, at least once a week, throwing up, and in a dark room, they can't hear or smell anything, or else it'll cause more vomiting. And it's a horrible existence. And that doesn't have to be that way. And once people realize that that's not what life has to be like, that's not your reality, does not have to be your reality, their lives can actually change. But telling them that something as simple as a chiropractic adjustment can change that kind of blows their mind a little bit. For me personally, I like to call them miracles, because I believe that people walk into my office for a reason. I believe when they walk in my office, they're looking for a solution to their problem. I've had people come from the Mayo Clinic and they couldn't figure out what was going on with them. And I tell them something this simple, they find it rather amazing. They're in disbelief. And I say, if you just give chiropractic a chance, if you just give it a chance to work. Now, sometimes we're dealing with, decades of trauma, decades of degenerative change. So sometimes it is an uphill battle. But knowing that there's a plan, knowing the plan does not include more drugs, does not include surgery, does not include Botox injections, does not include everything that they've tried, but it's something different. I think that right there kind of says, okay, let's try this. It's very gentle. It's very precise. And I get to see those miracles in my office every single day. It warms my heart when I see people actually living their purpose when they no longer have this obstacle.